So let us begin. Unfortunately, we have got some technical problems. That is why we just delayed by valuable 4 or 5 minutes we lost. Sorry for that. So today the 382nd day of International Homeopathy continuous Zoom session. So before starting the proceedings, let us have a silent prayer for a moment. Thank you. Today we have an important session. Our guest is Dr.M.B Sreekumr, DHMS, Ayush Medical Officer. To present a topic on an important subject, the management of COVID. He is a medical officer, Ayush Primary Health Center, New York, Gram Panchayat, Kerala, India. Dr. Sreekumr graduated from Dr. Padiyar Memorial Homeopathy Medical College in 2001. He has 20 years experience in homeopathic clinical practice. He is the author of a book, The Technical Guidelines of Homeopathic Management of Musculoskeletal Diseases. Worked as faculty in homeopathic clinical subjects for medical officers in Department of Homeopathy in Kerala and different homeopathic organizations. Winner of PP2 presentation, the first international Ayush conclave held at Thiruvananthapuram. Treated many COVID cases in countries like UAE and UK. Got a lot of experience in the treatment of COVID. So, on behalf of IFPH, I am welcoming you, Doctor, to the topic scope of homeopathy in moderate and severe cases of COVID. So you can have the next 45 minutes platform. Thank you.
So let me share the slides.
Dr. Abrat, please make Dr. Sreekumr as co-host. Okay, you can start. Yes, okay, visible.
Is it visible?
Yeah, of course.
Okay. It's moving also.
Yes, of course.
Okay. Thank you, Dr. Manoj. Is it audible?
Oh, okay.
Thank you, Dr. Manoj, for inviting me to this prestigious program. I think it is the longest program ever conducted in a webinar series, almost 382 sections. A lot of tremendous effort behind this. I appreciate that. And congratulations to all the team members for this effort. During COVID times, we homeopaths have a lot of fame in the field due to prevention of the disease in the name of ourselves and then treatment. And now we are treating the cases. A lot of cases are being treated. My first experience started in 2020 March, when a case called from Abu Dhabi. That was a mild case, only 25-year-old young man, a bank officer. He has some mild symptoms, and I have prescribed aconite, bryonia, like that medicines. And he recovered within 5 days and tested negative in 10 days. So at that time, testing negative was a very important factor. Now it is seen that testing negative is not an important factor. But at that time, that was a tremendous achievement. So that patient referred many cases to me, his colleagues and his friends, his relatives. So I have got almost 62 cases in 50 days, 50 to 60 days from UAE, then from UK and such countries. So in that 62 cases, almost 7 cases were COVID pneumonias. Diagnosed COVID pneumonias, they have went to hospital and took X-ray, but they have not gained proper treatment from the hospitals due to heavy rush in hospitals. So they remained in their flats and asked me for treatment. At that time, I prescribed about 21 remedies, and they collected it from a local medical store. And at that time, I attended their WhatsApp calls and prescribed for them because I was very curious about the newer disease at that time. So almost all cases are recovered well with our medicines, with the homeopathy. Thereafter, hundreds of cases came from different parts of India, and now we can see a lot of cases in Kerala, where all doctors are treating different type of COVID cases. The major pathological difficulty in COVID cases is pneumonia. Pneumonia is the basic pathology which causes complications in COVID cases. So there is a tremendous scope for homeopathy in COVID pneumonia, especially viral pneumonia. So we will discuss some parts of some of the aspects of our treatment management criteria in COVID pneumonia. We will start with some of my cases. Some pneumonia cases, 2 from first wave and 2 from second wave. This is a first case. So it's a first wave case and moderately severe cases from UAE. Case from UAE, 41-year-old male. This was also a bank officer. The patient contacted me with a cough and fever with the dyspnea. Temperature was 37.9. Other symptoms were red eyes, congested face, cough on talking, severe chill, sleeplessness at night, general weakness, and headache on coughing, offensive expectoration, and diarrhea. At that time, I already said I was very curious about the case, so I took the cases in very detail. So red eye was a common symptom in the first wave, but in the Delta variant, red eye is not so common. So this was the presentation. He was gone to hospital and checked. With X-ray was taken, he had established pneumonia in both lungs, bilateral pneumonia. So he has almost 14 symptoms on the first consultation: cough, fever, dyspnea, fever, red eyes, congested face, cough on talking, severe chill, sleeplessness at night, general weakness, headache on coughing, offensive expectoration, diarrhea, and cramps in different parts of the body. The dyspnea was so severe that he was unable to go to the toilet, even to the kitchen also. He was living there alone. So it was very difficult for him to move. He called several times in the emergency number, but they don't took the phone because of the rush in hospital. So I prescribed a group of remedies to him, and there was home delivery of homeopathic remedies from Abu Dhabi, a medical store. So he purchased all those medicines. The first prescription given was Bryonia 30. But the medicines getting there are on 3-grain tablets, not like a powder or dilutions. So 1 tablet 4 times given to him, and Ferrum 6X tablet also given 3 times for controlling the inflammation. The follow-up in the evening, this case was reported in the morning, and evening patient was reported that there is a relief for fever. At that time, Bryonia was acting very well in those cases in UAE and UK, such countries. So early, the first wave was very much responding to Bryonia. Nowadays, the scenario has changed. So the patient has relief from fever. Then patient has cough, dyspnea, red eyes, congested face, general weakness, headache on coughing, etc. remaining. So there was there is cramps in different parts of the body. The patient was very much cramping in different parts of the body. So he was unable to move from his bed. Then I prescribed phosphorus 200, 2 doses, 2 hourly. That was also tablet form. So 1 tablet is useful for 1 dose. Then 2 doses, 2 hourly given. Then 1 dose of cupromet is also given for cramps. On day 2, fever relieved, cough and dyspnea persisting, intensity less than previous day, headache in the region of sinus, yellowish postnasal dripping. He has also severe headache due to sinusitis. Then Kali bichromic in 200, 3 doses given on the day, 2 for severe sinus pain, 1 hourly. Then headache relieved by diarrhea starter again. Then he got a severe diarrhea. Then Arsalb 30, 2 doses given, but no relief. Then Viratramalb 30, 3 doses given. So suddenly diarrhea stopped. Diarrhea got relieved at night. On day 4, 18/4/2020, there was great dyspnea on session, cough and weakness with nausea, slight fever again. Then lycopodium 203 doses given, followed by Ifph 30 in 4 times. Lycopodium is a greatest medicine for resolution of pneumonia. So lycopodium was prescribed. Then day 5, general amelioration with the dyspnea and cough, rattling chest with weakness. So lycopodium 200 morning and evening doses continuing for some days. Then antimony tortoricum 33 times given. Because the acute cases are like 2020 cricket, we have to prescribe frequently. In chronic cases, we have enough time for prescription. So frequent repetition and frequent alteration of the medicine is given in these cases. And these are all teleconsultation also. The rest of the days, the symptoms were under control. Antitot continued with occasional doses of lycopodium for few days. And the patient got negative after 18 days. And he had a severe pneumonia in both lungs and got negative within 18 days. And he's doing well now. Our remedies acted very well in those cases. I think the quality of medicines in that area is also very good. Even small doses given best results. Then first wave case from India, Bangalore, 43 male. This is also a case, a husband of a doctor from Kerala. He had expectoration, severe expectoration, brown expectoration with pain in chest and breathlessness with a high fever, almost 101, throat pain and mucus collection. And the doctor suspected, he was in a CFLTC there, and the doctor suspected myocarditis in this patient. Due to heavy rush in hospitals, the patient also remaining in the CFLTC for a long. The oxygen level was 90. Weakness and chest discomfort. Case got positive in July 22nd and reported me on August 2nd. Then suddenly, I have prescribed Calibake 200, Sulfur 200, Phosphorus 200 and a series. All these medicines are given in a series because phosphorus is a good remedy for myocarditis. Phosphorus is also added. Then Viratromoride 30 for fever, 3 doses also given. On August 2nd, sleeplessness, throat symptoms relieved, brown expectoration stopped. Then temperature 100, then PSO2 was 89. Weakness and chest discomfort better. They were giving oxygen to that patient. Sulfur 200, 1 dose given. And the important factor is the doctor allowed to give homeopathic medicine to the patient. Then sulfur 200, lycopodium 200, and phosphorus 200 given a series 2 times in this case. Then August 3rd, temperature was 99, PSO2 again down to 80. Then August 4th, temperature 98.8, PSO2 85. 2 loose stools, chest pain better. Carbohydrate 200 added in that series, lycopodium and phosphorus given in a series 2 times. Took 1 doses of anti-TAR 200 at night. Herbas and tincture given 2 times a day for absorption of the effusion. On August 5th, temperature 98, PSO2 92. Anti-TAR, carbohydrate and lycopodium series repeated 2 times. On August 6th, PSO2 95, temperature 97.8. Lycopodium 200 morning and evening continued for 3 days. On August 9th, the EPIS 200 given 3 days for reducing pleural edema. He has a severe chest pain after recovering from the pneumonia. So EPIS 200 given. And he has got negative on 10th August. Another case of pneumonia, case number 3 from 43-year-old male from male in second wave. This is in the second wave. The patient reported on August 1st, 2021 was hospitalized due to COVID pneumonia, severe category C. He has got negative on 27/7/2021. He developed COVID pneumonia after got negative, COVID negative. This is a report from the hospital. He has severe COVID pneumonia, C category pneumonia. And the patient bystander called me just before they have shifting to ICU. So I requested them to not shift to the ICU. Then patient purchased all these medicines and given, and at the evening, before they are shifting to COVID ICU, the patient was presented with low oxygen and breathing difficulty. PSAT was 85 without oxygen, 90 with oxygen. And there was severe chest pain, palpitation on walk. The presentation on day 1, patient was in resolution phase of pneumonia with threat of fibrosis, severe breathing problems. So for resolution, I have given sulfur 200, lycopodium 200, and carboj 200 in a series 2 hourly. The general improvement in breathing problems on day 2. In the evening, doctor came and told it is not necessary to shift to the ICU. So there was general improvement from the first medication itself. Then sulfur 200, phosphorus 200, and carboj 200 given a series for the day for 2 times next day. Then day 5, overall improvement, chest pain on breathing. In blood test, D dimer was very high. So Borthros 200 given 3 times for another 3 days. Then sulfur and lycopodium given for another 5 days, morning and evening. Day 3, fever subsides, chest oppression, improvement on walking, slight headache present. So sulfur 200 and carboj 200 given morning and evening doses for another 3 days. Then Calibake 200 given for headache. The patient discharged safely in 1 week. Then case number 4, a pneumonia case treated at home. This was the mother of a doctor. She also kept her mother at home without going to hospital. So it's a 67-year-old female with fever and breathing difficulty. SpO2 was 82. This X-ray sent to me. This X-ray is after some resolution has happened. Day 1, the patient has high fever and thirst with chilliness. First, phosphorus 200 given in water doses for 2 hourly. Then viratromor 30, SOS for high temperature. Then day 2, fever subsided, SpO2 remaining 85, difficult breathing and walking. Then antimonium tartar 200 given 2 hourly in water doses. Carboj 200 given 3 times. In all these cases, common remedies are given. Then SpO2 91 to 92, no fever. Patient better and eaten well, is discomfort on moving into toilet. For pneumonia resolution, sulfur and lycopodium 200 given morning and evening respectively for 5 days. Then follow-up X-ray was very clear. It's also sent to me. So these are the 4 cases of pneumonia. Two are in the first wave and 2 in the second wave. So from these cases, we are very much convinced that pneumonia cases can be very much good control, very much controlled by our remedies. So these are the clinical categories of COVID cases. First, asymptomatic patients, individual without any clinical signs. These patients should be carefully watched because some of the asymptomatic patients may develop complications. So we have to prescribe some medicines for them, even no symptoms. Then mild cases are there which are mild clinical symptoms or lower or upper tract infections. Then moderate cases, patients with the moderate cases are with the patients with pneumonia. Then there is severe cases, acute respiratory distress syndrome is developing in that cases. Then patients with the very severe critical cases. In severe or very critical cases, we have no much scope, I think, because there is multi-organ failure and cytokine storm. So we have to prevent the cases from mild to moderate to severe cases. In that scenario, we have to manage patients well, so that they won't go to the severe or critical cases. What are the difference between first and second wave? In the first wave, cases went up to third phase once in a while and except in rare occasions resolved by medication and supports. Rarely cases went to fourth phase. But in second wave, more cases went to third and fourth phases, maybe due to rapid spread and mutations. That is the difference between first and second wave. The treatment of second wave is much more difficult than first wave. I feel like so. Then we have some limitations also. We have no first line treatment centers. In second wave, many patients are fell down due to vertigo. In some cases, labyrinthine apparatus is affected by the virus. So the patient is falling down in the bathroom. So in some cases, patients have hypoxemia. So we have no facilities for oxygen supply. So it is very difficult to treat patients in severe cases in home. In home quarantine patients, follow-up prescription and dispensing is very difficult. A collection of remedies should be provided for each family for right prescription, which is practically difficult. In some cases, there is rapid deterioration of the health. So all these cases are difficult to manage from a OP perspective. Like already said, sudden collapse and fainting in the patients without oxygen issues are seen in many cases due to labyrinthine effects. Then sudden hypoxemia is seen in some patients which require oxygenation. Then severe high temperature. Low hypoxemia without suddenness we can manage with some of our medicines. But with sudden hypoxemia and severe collapse of the patient, oxygen may be needed. In some patients, there is high temperature. We cannot treat a complicated case from an outpatient perspective. There are other possibilities that the patient is in a hospital. We can manage give medicines for them. If patient is under observation from a medical professional, if a doctor is present in their home, we can manage with some of our medicines. Or if a nurse is there, we can manage such cases. Then the question is, what are the scope of homeopathy? We have managed. Can we manage COVID pneumonia? Yes, COVID pneumonia is well managed by homeopathy. Can we manage ARDS? Early stages of ARDS, acute respiratory distress syndrome, is managed by homeopathy. Can we manage cytokine storm and multi-organ failure? This session we have to study. A third phase we have to study in the interdisciplinary studies are needed in these cases because we have not much exposure to all these cases. Mostly these cases are in the ICUs. So if there is an interdisciplinary study, we can test our medicines in these cases. Anyway, pneumonia and ARDS. Pneumonia is well managed by homeopathy. So if a prescription is doing in COVID pneumonia, that cases won't go to ARDS or multi-system failure. Then what is ARDS? ARDS in early stages of ARDS, fluid from the smallest blood vessels in the lungs starts to leak in the alveoli. The alveoli is filled with a lot of blood. The lungs become smaller and steeper. Then hard to breathe. The patient is hard to breathe. The amount of oxygen in the blood falls. That is hypoxemia happens. The body becomes starved of oxygen. This harms the brain and other tissues and leads to organ failure. These are the 4 stages of ARDS. ARDS is a clinical syndrome precipitated by pneumonia. So if pneumonia is well managed, ARDS will not happen. Usually in allopathy, for viral pneumonia, they have no medicines. That's why the complications are more in their system. In lung, there are 3 phases of ARDS. There is exudation, that is pulmonary edema. There are a lot of medicines for pulmonary edema in our homeopathy. The most of the common remedies, polycrust remedies, we are given in the first 4 cases were effective for pulmonary edema. Then some proliferative changes, interstitial inflammation is happening. Then fibrotic changes. When fibrotic changes are happening, the patient may not survive. That's a stage. That's the status now. Then what is the scope? Homeopathy can work as a prophylactic to complications like ARDS and multi-organ failure. Early stages of ARDS can be managed by homeopathic medicines. Severe ARDS and multi-system failures need oxygen support, ventilators, and intensive care. So homeopathy acts as a prophylactic in all stages of the infection. If you are treating unduly sick patients, you must need some cooperation of the patient and bystanders. Then good vitality of the patient. Then knowledge of the remedies that are capable of managing the sick as well as progressing pathology. There's sometimes facilities for supportive care, adequate investigations, frequent short space follow-up and admission. These are the requirements for treating unduly sick patients. Then what are the major types of fever presentations? They are influenza and other mild fevers. In COVID-19 cases have almost the characteristics of most of the fevers. That is influenza and mild fevers. Some COVID cases are like influenza and mild fevers. Then continuous fevers are there, continuous low fever. That is the patient is on continuous fever. In pneumonia cases, there is continuous fever, continuous low fever, not fluctuating more than 1 degree Celsius. Then remittent fever. Then high fever, high continuous fever is seen in remittent fever. COVID has the characteristics of both continuous fever and remittent fever. Then respiratory fevers like bronchitis, pneumonias, etc. Then gastric and bilious fevers. Some fevers have gastric characteristics of gastric fever. Then septic fevers, characteristics of septic fever. Then intermittent fever. All these characteristics are merged in COVID-19 patients. Three major signs which are lacking in COVID patients include brain fevers. The symptoms of brain fevers are not seen in COVID patients. Then urinary infections are very rare. Then exanthematous fevers are not seen in as a part of COVID-19. Then elements of prescription. We homeopaths have a lot of elements for prescription. The first element is prominent mental symptoms, especially if you are getting right mental symptoms, we can prescribe early. Then thermal reaction, activity changes, etc. are there. That's also important. Then fever are the definite exciting causes, including seasons. In COVID cases, there are no exciting causes actually. Weather changes are not affecting COVID infection. Then sensations are there, peculiar symptoms are there. Sometimes peculiar symptoms we are getting. Then associated symptoms like concomitants, then type of fever, then modalities. In some cases, the clear involvement of system organ, especially in COVID, there is a clear involvement of lungs. So we can prescribe lung involving medicines in those cases. Then clinical condition and pathology. These are all the 10 elements of prescription. If you are getting only 1 or 2 elements in the case, we can prescribe. That is the advantage. There's a golden rule that unless you have a clear picture, won't give a medicine first, which is later stage medicine usually. So we have to prescribe accordingly, according to the stage of the patient. In COVID cases, the first affection, state of affection is the upper tract, usually in the nasal tract. The catarrh symptoms, including headache and flu-like symptoms, are seen. Then we have to restrict the remedies to that state in all cases. There are first stage remedies for us. Then bronchus and other upper part of the lower tract is being affected. Then bronchus, mild cough and loss of taste and smell are seen. Then lower tract is affected, that is bronchus and lower part of the bronchus. Then lungs are affected. Then we have to move to the lung remedies. Then in some cases, gastric symptoms are prominent. Then we can see some expressions of the some COVID-late pathologies. Dr. Manoj, please inform me if the time is exceeding.
Okay, you can continue, doctor.
Okay.
Yes.
Then pulmonary edema. Pulmonary is a major pathology behind COVID diseases. There's a difficult breathing and aggravation from lying down. The cough that produces frothy sputum tinged with blood. Wheezing or gasping for breath. Cold, clammy skin, anxiety, restlessness, and greater apprehension, palpitation. These are all the symptoms of pulmonary edema. Usually, a complicated pneumonia case have pulmonary edema. So, pulmonary edema, we have some remedies that is acting well. In stage 1, the first remedy is arsenic herb. There's a general dose of pulmonary edema and pericarditis. The patient is restless, anxious, and fear of death. This is a common symptom of arsenic herb. Then one of the best remedies for pulmonary edema is epismel. The characteristics of epismel is that it has rapid breathing. Fast breathing is the symptom of epismel. The remedy induces a type of diuresis helping to clear pulmonary edema. That is the main indication of epismel. Epis and laches are the major remedies used in acute respiratory distress syndrome, to relieve the acute respiratory distress syndrome. Epis mellifica and laches. These are remedies given good results in many cases. Then bryonia is another remedy. Pulmonary edema with the early stage of pneumonia. That's also a good remedy in early stage of pneumonia. Then the complementary of bryonia is calicarb. Calicarb also have pulmonary edema. Pulmonary engorgements, weakness of the heart muscles with anasacra of feet and ankles. So in stage 2, the first remedy is ammonium carbonic. When pulmonary edema with much oppression in the breathing, wears on any effort, patient can't move. That's a peculiar symptom of COVID pneumonia patient, that a patient cannot move to bathroom or kitchen. So such cases are require ammonium carb. Ammonium carb is a very good remedy in COVID pneumonia with the pulmonary edema. So then there is an anti-ammonium tartarium. The cough and dyspnea due to pulmonary edema or obstructing mucus in the bronchi. Patient is better sitting up. And anti-tart have many other symptoms like rattling in the chest, very difficult, very heavy weakness. All these symptoms are seen in antitar. Then lac cases. Lac case of pulmonary edema with pneumonia. We have to look for other symptoms of lac case also. Then lycopodium, pulmonary hemorrhage and edema with pneumonia. Then phosphorus. These are the major remedies for pulmonary edema, lycopodium. Both pneumonia and pulmonary edema, same remedies. So lycopodium, phosphorus, antitar, all these remedies. So that's why I have given these medicines in series in those cases, because it was in a critical state. So I have prescribed in series. If any remedy is wrong, another remedy will act. That is my motto. Then stage 3, then Carbovich. Carbovich is a very good remedy in stage 3 because there is a chance of developing fibrosis after pneumonia. Then iodine. There is a low oxygen levels in also in Carbovich. Carbovich is the most efficient remedy for recovering patient from the hypoxemia. Then iodine. Iodine is a very good remedy for pulmonary edema, tendency to bronchial and pulmonary congestion and hemorrhage, especially when cough is dry. Then Mersol and Borthrop. These are the other two remedies for stage 3 remedies for pulmonary edema. Then another important pathology which is happening in COVID cases are fibromixed exudation. That is protein-rich exudation. In many cases, we have seen that a lot of exudation, usually mixed with some cases, it is mixed with the blood. If it is mixed with the blood, kali bike is the best remedy for relieving. In many cases, I have got results of pneumonia from kali bichromicin if there is blood injured split. Then another remedy: sulfur, phosphorus, bryonia, kali bike, ipecac, senega, and calciresol. These are the common remedies effective in fibromixed exudation of the pneumonia. Then another most important complication is myocarditis. During the first phase, when I was treating some pneumonia case, I have consulted an allopathic homeopathic and allopathic both doctor having both the BHMS and MBBS, and I described my case. He told that there is chance of developing myocarditis in our patient, so please refer that patient. So I referred some materials, and I seen that phosphorus is the best remedy for myocarditis. So I prescribed phosphorus in most of the severe case of pneumonia. So almost all cases were recovered from myocarditis, complications. So that's my experience. In myocarditis, the main symptoms are chest pain, rapid or abnormal heart symptoms, heart rhythms, shortness of breath, and swelling of the legs. If there is swelling of legs, there is a chance of myocarditis or pulmonary edema. Edema of the legs, we have to look for the symptom. So the best remedies for myocarditis include phosphorus. In all type of fever, even after vaccination, some patients are developing myocarditis. So phosphorus is the best remedy for myocarditis. Then sulfur and bryonia. Then lacosis. Adonis is a good remedy for cardiac. It's a cardiac tonic. So we can give Adonis also with these cases, these suspecting cases. Then heavy and boggy lungs. Due to excessive fluid collection, some lungs are seen as heavy and boggy in CT and X-rays. So we can prescribe Carbovich in that patient. Carbovich is very good remedy for such cases with the low oxygen levels. So another pathology is patchy consolidation of the lung. Is the expression is same as real pneumonias. Kalisulf and Senega is a good remedy for patchy consolidation of lung. In most of the COVID cases, there are bilateral COVID. Bilateral pneumonias. The sulfur and lycopodium are the best remedies for bilateral pneumonias. So that's why these two remedies are mostly effective in COVID pneumonias. So if there is patchy consolidation, we can consider Senega and Kalisol. In some cases, I have given Senega, giving good results. Senega is very similar to anti-tartarium, antimonium tart. There is a great rattling in the chest. Then another important pathology is intravascular coagulopathy. Shortness of breath is the main symptom in intravascular coagulopathy, but I have not really treated such cases. One remedy is seen in Meteormedia is Crotalus horridus. We have to check the effectiveness of this remedy. So there are a lot of initial phase remedies in COVID cases. So we have to prescribe these remedies with the utmost care so that the case won't go to the pneumonia or other complications. There are some remedies for the nervous symptoms, usually aconite, arsenic, carbon, axomica, epismel, ferrambos. I am not describing the symptomatology of this because time is very limited. So there are catarrh symptoms, the aconite like aconite, arsenic, carbon, gelsemium, pulsarilla, restos, camphor, epitorium. These are the early stage catarrhal remedies. Then some cases have gastric symptoms. There is axomica, ipecac, bryonia, sanguinaria, arsenical, pulsarilla. Then bronchial symptoms are there, ipecac, bryonia, epismel, and sulfur. These are the initial phase remedies. We have to prescribe. We have to select these remedies very carefully with the thermal modalities and so on, mental symptoms, etc. Then the lower tract, dry or productive cough is a major symptom. Then difficult respiration. Then our target of treatment is the control of the cough, then fever control, managing breathing difficulty and maintaining oxygen level, resolution of the lung inflammation. So in this stage, we have many remedies like ipecac, bryonia, pulsarilla, calcarea, carbodrosera, caustic, spongia, etc. These are all good remedies for COVID bronchitis, and we have to select these remedies very carefully with the symptomatology. Then COVID-19 pneumonia. Pneumonia is a major issue, I have already said. So we have to manage COVID-19 pneumonia very well so that no organ failure happens. So don't panic with oxygen levels. Oxygen level, most of the patients, most of the doctors are panic with oxygen levels because preferable oxygen level is about 95. If the patient has PSAT less than 80 mm, arterial hypoxemia. 79 to 70, mild hypoxemia. 60 to 69, moderate. Severe hypoxemia is below 50, below 60. That is a condition. So if a patient with the COVID pneumonia has 80 mm of PSU2, we have not to worry too much because if the patient is stable, we can treat that case with the medicines or medicines. If the patient is unstable, we have to give oxygen to that patient. I have some cases with 80 mm of arterial hypoxemia. That cases responded to our medicines and got good oxygen levels within 24 hours without oxygenation. So don't worry with the oxygen levels too much. We have many low oxygen remedies in our Meteormedia. In the initial phase, there are two remedies which are very important, ipecac and ferrumphosphoril. Ferrumphos is a good remedy for hypoxemia and it's an anti-inflammatory too. So in almost all non-symptomatic cases and mild cases, I am giving ferrumphosphoricum 30 continuously throughout the infection because that may stabilize the inflammation and oxygen level of the patient. Then further stage, in pneumonia stage, we have a lot of remedies for oxygen maintenance. That's Kalisalv. Then ammonium carbide is a good remedy. Then phosphorus, lycopodium. Almost all pneumonia remedies have a property to stabilize oxygen level. So there is no specific remedy needed in pneumonia stage, but we have to treat the pneumonia. Then the oxygen levels will be normal. The homeopathic medicine selection criteria in pneumonia is one is stage of the disease, investigation findings, and character of symptoms. Stages of pneumonia include the first stage is stage of congestion. Stage of congestion is almost 24 hours. There is congestion of capillary occurs. Cough and deep breath are very important symptoms. Then stage of hepatization and resolution is usually 1 to 2 weeks. Usually the cases we are getting is in the resolution phase. In resolution phase, there can be fibrinous exudates that fill the alveoli and resorption and restoration of the pneumonia is happening in this stage. The stage of complication is the third stage where ARDS is developing. The pneumonia cases may convert into ARDS. Then acute cardiac injury, septic shock, and acute kidney injury. So that all these complications can happen. So we have to treat the patient very well in stage of congestion and stage of hepatization so that further complications are not being developed. Then some character symptoms are chest pain, nature of expectoration. We have to study the nature of expectoration, degree of weakness, intensity of short breath or fever, dry or plaque cough. General symptoms of patient like appetite and thermals are to be considered. Then investigation finding are also important. There is degree of hepatization. Hepatization, if a bilateral hepatization is there, sulfur and lycopodium acts well, because double pneumonia is very well indicated by sulfur and lycopodium. Then edema of the lung. In patchy consolidation, we have seen that Stenega is a good remedy. Then there is an edema of lung, which indicates myocarditis or pulmonary edema. Then cardiac involvement, liver affections. These are all we have to study. Then chest symptoms. First, chest symptoms. Usually, chest pain pneumonia is largely due to pleurisy. So, in early stage, in congestive stage, we have many remedies for chest pain of pneumonia. That's Ifph mellifica, arsenic album, bryonia. Chelidonium is usually pneumonia remedy, but not indicated well in COVID cases. But epismel, arsenic album, bryonia are the three remedies mainly indicated in first stage of with the chest pains. Then stage 2, kali bichromicum, pulsatile and phosphorus. Phosphorus and kali bichromicum are the important remedies in pneumonia, established pneumonia cases, chest pain with the established pneumonia cases. If you are giving that medicines, we can control the myocarditis and complications pneumonia also. In the third stage is mersol. Then we have to study the nature of expectoration. In early stage, arnica is having bloody expectoration. Then arsenic album, rusty sputum. Rusty sputum is a common presentation of COVID pneumonia. So in early stage, arsenic album is very good remedy. Then lycopodium, lycopodium has purulent sputum. Heparsulfur purulent sputum, pulsatile rusty sputum, kalibic tough stringy sputum. The difference, both kalibic and arsenic album are very similar in metromedica, but their symptoms are somewhat different. Kalibic have tough stringy mucus, but arsenic album have watery discharge. Then another remedy is phosphorus. Then stage 3, expectoration, carbovich, mersol, and iodine. These are the three remedies. Then degree of weakness. A profound weakness in early stages, usually arsenic album is the best remedy. Then in pneumonia cases, we have some remedies. Profound weakness is baptisia, the first remedy. Generally weak, restless, fall asleep in the midst of a sentence. If you are asking the patient something, the patient will sleep in the midst of that sentence. Then antimonium tartar has also severe weakness and exhaustion with the great depression of spirits. He has also pneumonia and great rattling of the chest. Then sulfur is a good resolution remedy in pneumonia with the severe weakness. Then lycopodium and phosphorus also have similar symptoms. Then carbovich is another remedy for weakness and pulselessness in COVID cases. Then another factor is intense fever. Intense fever. If you are intense fever during pneumonia, we have some remedies, specific remedies. First one is Viratrem. High fever with violent palpitation, full and hard bursts. Usually, COVID pneumonias are very well managed by Viratrem with high fever. So, in a late stage of pneumonia, there is high fever. Iodine is a very good remedy. Iodine. In all stages of fever during pneumonias, phosphorus is the very good remedy. Phosphorus will control almost all fevers in COVID pneumonias. Then late stages, baptisia and acid muriatic. Then ARDS remedies include epismel and lac are the major remedies for controlling acute stage of ARDS. In some cases, have got results with epismel and in some cases with the lac cases. Then lobelia is also a good remedy. Then dry or productive cough, that's the difference. Usually dry cough seen in sulfur, iodine, and phosphorus. In pneumonias, dry cough seen in sulfur, iodine, phosphorus. Even though chest has collection of mucus, dry cough is seen in sulfur, iodine, phosphorus. Then productive cough is seen in kalibic, pulsatile, antitard, carbovich, and lycopodium. That is a difference we have to study. Then there are some general symptoms. We have to look for general symptoms. Some patients are chilly, antitard is chilly, epismel hot. These are the difference between some general symptoms. But in advanced cases, we must not rely on too much on these thermal reactions because pathologically our medicines will act in all those cases. Yes. In investigation findings. Then there is degree of hepatization. Usually stage 1 hepatization, bryonia and Viratrem. These are the two remedies in stage 1 hepatization. Then stage 2, sulfur, phosphorus, lycopodium, and antitard. Then stage 3, iodine, mersol, Viratrem, alba, and carbovich. Then side affinity.
How many stages needed you? I
Okay.
think if a lot of things to say, we can have a second session.
No. I think 5 slides more.
Okay. Otherwise, we can have extended session another day. Plenty of time. We can have a discussion, nice discussion also here, because there are a lot of learned person here.
If you can give 5 minutes, I can complete.
Okay.
Then side affinity, right or left, both lines. If the right side is affected, like body and it are cheldonia, left iodine. Double side sulfur and lycopodium. That's an important feature. Double side pneumonia, sulfur and lycopodium. Other pneumonia remedies include pyrogen, the lacases and merosol. Pyrogen is indicated in many cases with a rapid onset of pneumonia with a very high temperature and rapid pulse. Pyrogen will relieve the fever and pneumonia. Then we have to give other remedies also, but pyrogen will control the case. The lacases is similar to baptisia, usually cyanotic, puffy face, and great suffocation. This is a good remedy for acute respiratory distress syndrome. Then merosol and like remedies are there. Then continuous nature of fever. Some fevers have continuous nature. In such cases, we can give one first remedy is selenium arsenium. There is great prostration, profuse set, and continuous fever. Then arsenic alb. Selenium have no pneumonia symptoms, but in some COVID cases, there is continuous fever, severe continuous fever with the severe prostration. In that case, such selenium may be a good remedy. Then arsenic alb have continuous nature of fever. Then another important remedy is acid phosphoricum. Fever like typhoid fever that's continuing low temperature for a long time. In such cases, we can think of acid phos, especially with the dull comb prevention. Then baptisia is there, phosphorus is there. Then acid mur is also there. In advanced cases of fever, we can think of acid mur, baptisia, phosphorus like remedies and chininamers. Then some childhood complications also seen in COVID. That is a MISC is a term for used for the disease. Multi-system complications are seen in some children due to COVID. I have seen 2 cases that were discharged from a hospital, medical college hospital, and came to me for further treatment. The patient was almost symptomatic during the COVID illness, but they have developed sudden complications and there are multi-system failure, and they have survived with some steroid medicines. So we have to be very careful about our children while COVID infection. I am giving ferrophos for all children with the COVID infection to prevent complications. I am not sure whether it will control the complications or no, but I am giving this medicine for children. Then I have during the first phase I have collected all these cases and given to Srimati Shaila teacher, our health minister, and director and DMOs. But it has not given much results, but reports are being given. So that's all about my experience in COVID-19. So I think I will wind up. The time is going away. So thank you very much. Okay.
Very impressive session. You have learned a lot and how hard work is done. So now it's time to have a brief session on question answer. Only 5 minutes remaining. Those who are interested to participate, please go to the participants and raise your hands. Could you please close the screen sharing? Okay. Yes, Dr. Bhadran, Dr. Raisa, Dr. Bhadran. Sir, please.
Hello.
Yes, please.
Thank you, Dr. Sreekumr, for your enlightening class on management of COVID pneumonias and COVID-19 cases. I think I have to share my experience in this regard.
Doctor, only we have limited time, Doctor.
So I shall wind up shortly. I need 2 minutes.
Okay.
Then usually in the first stage with fever, chill, and headache, throat pain, and discomfort test, I usually give gelsemium. to majority of cases, followed by pulsatilla 200 daily 1 dose. In rare cases, 2 doses. I invariably give eucalyptus and Seneca tincture twice or thrice daily, as the case demands. And, now, usually it was relieved within 3 to 4 days, or up to 7 days formerly. But now I have found it to cure the case in 2 days. This week I have seen 4 cases subsided within 2 days. You may also try. I also give severe lung infection case. I usually give Apis mellifica or phosphorus as intercom medicines. That's all I give. No, not much medicines I give.
Okay. Now, Dr. Hariharan Narayana, please. You can ask. Okay.
Can you hear me, doctor?
Yes, of
Hello?
course. Yes, yes.
Hello, I have it. Your class is fine, doctor. I want to know, one doubt is that after COVID, there is I have a patient that he is having severe palpitation after COVID. What will be the medicine?
Usually palpitation I see is usually due to heart involvement. So we can give iodine for that case. Iodine is the best remedy for palpitations.
Okay, it is after COVID, doctor.
Okay, even after COVID, iodine is a very good remedy for palpitation. We have post-COVID OP. We are giving iodine. Iodine is the best remedy for post-COVID palpitations. It's good, giving good results.
Okay.
If there is chest pain, we have other remedies also, that like Epis will remove the remaining edema of the pleural cavity. Iodine will iodine will relieve the palpitations. So very good number of remedies are there.
Doctor, for oxygenation, asbestos, what is your opinion about asbestos?
Asbestos is giving results in some cases, but in real pneumonia cases, asbestos is not giving much results, I think.
Now, Dr. Logmani Gupta, please. You can ask.
Yes, sir. Yes, sir.
Yes, yes.
Am I audible, sir?
Good evening, Anil.
Yes, of course, please.
Okay, sir. Thanks. A very good class, very good guidance for the treatment of COVID. Sir, one thing I want to add here, what I'm doing in my practice, that I'm using Justitia mother tincture also, along with all these medicines symptomatologically. So second thing I want to know, that you have given a very good guidance about palpitations, pneumonia, and other complications. Please add some neurological guidance also in your next class, as number of people are suffering with post-COVID neuritis and neurasthenia plus hair losses. This also we want to listen from you in your next lecture, sir.
Post-COVID is a big subject.
Yeah.
So that's why I have not included in this session.
Yeah, sir, but
Okay.
neurological complications are getting day by
Okay.
day.
Okay, okay.
So if any idea you can give in short,
Ah.
please give.
We are running a post-COVID clinic here. So we'll think of it in another class.
Okay, sir. Thank you, sir.
Thank you, Dr. Logmani, for the participation, valuable participation sessions. Thank you. Sergeant Doctor, do you have anything to ask?
I have something to say in
Yes, yes.
especially the case which Dr. Hariharan told. Palpitation. Palpitation is usually due to, my finding is that it is due to pneumonia and lung failure. Most
Okay.
part, lung affection may be there and lung may not respond well to the extraction. That's the usual. I usually give China, bryonia, iodine, and that sort of medicines in such cases.
Okay.
That's
Yes,
all.
now Dr. Hubert. Yes. Okay, thank you. Dr. Hubert, you
Hello,
ask
can you hear me,
questions
sir?
plus $8
Okay.
tax. Yes.
Okay. Can you hear me, sir?
Yes, yes.
Okay, yes.
It is a very experienced class. That is what I want to say. My comment is, it is an experienced class because you used many of the medicines and you studied it from it. That is a great thing. Most of the doctors are using 5 or 10 medicines and you are selecting from medicines from the repertory, and we will use only 20 or more than 20, we will not go. But you are experienced with all the things and you have studied it well, and you studied the actions of the medicines. That is a great thing. But I want to say one thing, in these such cases, you have to make a statistical study. While you are using so many medicines, I think that it is better we have to find out how much medicine is acting and which medicine is more acting and more efficient and more we can get more result from it. What is about what is about to say you? What to say?
Such a study has okay, thank you, sir. Such a study has done, but it is very elaborate session, I think. In each session, we have done such classes in earlier part of the first wave. There are so many remedies indicated in the first phase of the disease, that is during the upper tract infection, then the lower tract infection, and the middle part of infection. The most effective remedies are being described in those classes. That needs almost a 2-hour session to complete. So in another occasion, we will describe it in detail.
Yes, definitely we can have. Okay, thank you. Yes, doctor, could you please
okay, Dr. Vag, thank you very much. But I want to say one more thing for to clarify. You are using sulfur more often, but in such cases, in lung complaints, and is there any chances for a perforation?
No. Sulfur is a good, very good. Sulfur is a very good resolution remedy. It will resolve most of the pneumonias.
Okay.
That's my experience.
Okay. Thank you very much, sir. You are always welcome to our platform to enlighten us. Thank you very much for your class.
Now, what about Dr. Ganesh? Do you have something to ask? Ganesh?
Yes, Dr. Sreekumr, it's a very good presentation. You have done it in style also. You have chosen almost all medicines suitable for COVID and different conditions, particularly from acute disease to the chronic pneumonias and even fibrosis, and how to manage it. And this is what we require in this kind of platform, because a lot of people, a lot of doctors from different parts of the world are attending in this seminar, in this webinar. So I think you are for the first time visiting this webinar, but the thing is that most of the doctors are here joining us from different part of the world, and they are also sharing their experience. So this is one of the best platforms to visit, and I am very happy to invite you to this stage, and you have this platform, and I hope that you will be here every now and then, so that we will have a very good discussion in the future too. Thank you, Dr. Sreekumr, for coming over here.
Okay, thank you, sir.
Yes, well, that's a nice presentation. I think what happened is that he always says, I'm very curious. Yes, that curiosity led to the study all these things. That we must recognize it. Thank you, doctor. So I am appealing you must always come to our platform and share more and more experience. All in a very systematic manner. That is also remarkable. Well, that was the end of today's session, day 382, and it's time to go to Malayalam session. So thank you once again. So, Dr. Ganesh.